My name is Chidinma Onyekwe. Today I am presenting Proactive Health Communication Campaign, Impartial Fulfillment for the Requirements for the Course, DNPU 705. My county of focus is the El Paso County, situated in the westernmost county of the state of Texas. As of 2020 census, population of El Paso County was 865,657, making it the sixth most populous in the state of Texas. It is one of the two counties in Texas with the Mountain Time Zone, while others use the Central Time Zone. It harbors Fort Bliss, the largest installation in U.S. Armed Forces Command and the largest contiguous tract of restricted airspaces in the United States. The four leading causes of death in El Paso County are cardiovascular disease, cancer, stroke, and accidents. Unfortunately, these are all preventable diseases. One will imagine that with El Paso harboring a place like Fort Bliss, the military base, I gather that El Paso military base, the Fort Bliss military base is one of the largest, if not the largest, in the whole of the United States. So one will imagine that their health state will be wonderful. But sorry to burst your bubbles. Cardiovascular disease has 128 deaths in every 100,000 births in a year. Cancer has 113. Stroke has 88, while accidents has 38. All these are preventable. For the purposes of this discussion, I will focus on cardiovascular diseases. Some modifiable causes of cardiovascular diseases include obesity, smoking, high cholesterol, physical inactivity, and high blood pressure. According to CDC, smoking is the leading cause of preventable death. Worldwide, tobacco use can cause more than 7 million deaths per year. Isn't that alarming? A further look at the population health category of El Paso shows that access to care, that's those that do not have insurance in the county, is 23.8% versus nation's average of 10.6%. Adults with no leisure time in the county has 31.0% versus the nation's 26.5%. Smoking rate in El Paso County is 21.1%, which is higher than the nation's average of 15.2%. Heart disease prevalence in El Paso County, 6.7% versus the nation's average of 6.1%. Life expectancy for the county is 78% versus the nation's average of 78.2%. Overall, population health score for El Paso is 52 versus the nation's average of 75.2. This is from the El Paso County Health Report of 2019. Lifestyle modifications are very essential in order to curb these cardiovascular diseases. For example, people are encouraged to eat heart-healthy diets. What are heart-healthy diets? Fruits, vegetables. These are health-healthy diets that reduce accumulation of cholesterol. People should get regular exercises. It is believed that 15 minutes or 30 minutes of walk 3 times in a week is enough to keep you out of your doctor's office. Avoid smoking. Smoking is dangerous to health. Avoid overweight. Physical exercise and good nutrition will help in achieving good weight. And then maintain your regular checkups with your doctor. Overview of health promotion model. For the purposes of this discussion, Nola Penda's health promotion model was chosen. It was developed in 1982 by Nola Penda, a complementary counterpart to models of health protection. It is a guide to understand factors that motivate people to engage in certain behavior. It is a framework for research aimed at predicting health promotion's lifestyle choices. It serves as a tool to plan behavior modification intervention to assist in the improvement and prevention of unhealthy behaviors. It made some assumptions. It believes that individuals strive to control their own behavior. It believes that individuals work to improve themselves. It assumes health professionals like nurses and doctors comprise the interpersonal environment which influence individual behavior. And finally, it assumes that self-initiated change of individual and environmental characteristics is essential to changing behavior. This is a graph that shows you the individual characteristics and experiences that lead to behavior-specific cognition and affect that finally leads to behavior outcome. Some multimedia approaches for this health promotion include the use of posters. Posters can increase knowledge, change attitudes, and alter behaviors. The effectiveness of poster presentation is particularly present in the medical community, as they prove to be valuable in waiting rooms and great at conveying information. They are the most cost-effective form of publicity. Posters allow you to spread your message to a wide audience, far cheaper than radio or television advertisement, in a simple and easy and affordable way. The way posters are made enable you to influence and change public opinion and behavior on an issue. Being placed at public places and prepared with an eye-catching and strong visualization, they are an efficient tool to raise awareness. The next slide will show you my poster, and you will see how visually appealing it is. Then the next multimedia approach is a flyer. The flyers are mini versions of posters. The advantage of the flyer is that it is made for patients to take away. This allows them to refer to it at will and digest the information on it. The information is usually authentic and unbiased, and the language used is often simple and easy to understand. The images on the flyer should clearly support the health outcome, as is seen on this flyer. Next slide. You can see the flyer. Don't let tobacco take your breath away. You can see, choose health, not tobacco. The patient takes this home and is always referring to it. Then you can see a poster. This ought to have been bigger than this, but for want of space on this PowerPoint, it says, for a healthy lunch box, pick and mix something from each group. It shows you the variety of food that you can mix together to eat and be able to get a balanced meal that is heart healthy. The next multimedia approach used for this campaign is the brochure. An information brochure tells patients healthcare users and their family about the care that is being offered and add to the information given verbally by the healthcare professional. It is not a substitute for verbal information, but it can go a long way in helping the target audience to take part in decisions about their health. The next slide will show my brochure, Encouraging Healthy Lifestyle. Then another multimedia approach is the infographics. It's a collection of imagery, data, visualizations like pie charts and bar charts, and minimal text that gives an easy to understand overview of a topic. You can see a sample of my brochure, my infographic on this next slide. So this is a medical brochure and an infographic supporting healthy lifestyle. You can see how colorful they are, how catchy they are. Whoever sees them will really want to read them. On this next slide is heart healthy diet and activities. You can see how the fruits and veggies that make up heart healthy diet, you can see how they are arranged in a shape of a heart to make it attractive. And if you take a look at the content of the food, it's mostly fruits and vegetables, which are really heart healthy. And then you can see people doing exercises and activities, because we said earlier that physical inactivity is one of the major causes of cardiovascular diseases. So people in El Paso are encouraged to eat good diet, eat healthy diet, and engage in physical activities. Also, here is another flyer and infographics. This talking about tobacco and the next talking about physical activity. You can see a whole lot of information on the infographics for physical activity. This will really get patients seated to be able to digest the information on it. On this last slide is the other resources, the American Heart Association, the CDC, the National Heart, Lung and Blood Institute, and the Office of Women's Health, where you can get information concerning cardiovascular diseases if you so desire. Thank you for listening. These are my